Let's start. A 63-year-old female was presented to the emergency department with severe headache and vomiting that started 2 to 3 hours prior. She also has severe pain on the right eye, right eyebrow, and cheek. She's nauseated and has vomited twice since feeling the pain. She has noticed blurry vision from right eye and rainbow-colored halos around the lights. Denies flashes and floaters. She uses prescription glasses for reading. Smoker since age 20, drinks alcohol on occasion, denies any illicit drug uses. History of diabetes, degenerative disc disease in lower back, and seasonal allergies for which she is on medications. Now the question is, click to highlight 4 areas that need immediate follow-up. Okay? So that's the question. What do you think? And like I always say, try to make a picture of this person, a 63-year-old female coming to the emergency department, and this is going on, and she's sitting there, and you are talking to her and trying to get all this history, and trying to figure out, is it something emergency, or is it something like, which you can refer to a doctor later, or is it something where you have to act real quick so you can prevent some permanent damage, or what's going on? So what are your thoughts, and what are the 4 areas? It says 4 areas. So it gives you a clue, 4 things you have to figure out which need immediate follow-up. I'll show you here. Severe headache and vomiting, that's going to be one thing we are so worried about, because that's not okay to have severe headache, and look at that. It's like, it's not like you are having like migraine headache or some kind of headache for some time. Usually when people get headaches, it's like, gradual onset, and it will be there for maybe a day or maybe like few hours, more than like 2 to 3 hours. But this person, it's only been 2 or 3 hours, and it was so severe that she had to go to the emergency department for that. So headache and vomit, especially when it is associated with vomiting. Okay, now the other thing is there is pain on the right eye, eyebrow, and cheek. So her right side is like really hurting. And there is blurry vision from that eye, and she sees halos around the lights. So those are going to be our major 4 things which need immediate follow-up. Now you might be thinking, but she also, she's a smoker for 20 years, and that's too much. Does that need follow-up? Okay, it's bad, but is that going to kill her right now, today? Is that the reason she's here? Because she was smoking for 20 years? No, that's not the reason she is here. Okay, I understand she has history of diabetes mellitus. And will that need follow-up? Probably. But is she here because of diabetes? Is that the reason she's here? Is that really bothering her that suddenly, like within 2 to 3 hours, she was like, I have diabetes, I need to go to the emergency department? Is that why she's here? No. So that also is concerning, because we need to figure out what's going on. But at this moment, if I have to choose 4 things, this diabetes or degenerative disc disease or lower back pain or seasonal allergies are not going to be on my list of priority. They are there for me to check on, but it is going to be towards the bottom part of my list. The nurse is taking a list of home medications, because she said that the client said that she is having diabetes, that she is diagnosed with some kind of degenerative disc disease. And she also have the seasonal allergies. So we need to know what kind of medications she takes, right? Because it might be important and might be contributing. So it says she takes metformin for diabetes, which makes sense, very common medicine. Diphenhydramine for seasonal allergies. Again, it's like Benadryl and antihistamines, which people take, especially when they have the seasonal allergies. Most of them don't go to the doctor for allergy medicine. You just take over-the-counter medicine, right? So that's also something which is very common. Naproxen for back pain, and it's like as needed basis, which means it's a non-steroidal anti-inflammatory drug. So she don't need it maybe every day. Yes, she has the degenerative disc disease, which is not probably going to go away because it's degenerative and she's 63. So the age may be also contributing towards that. And so what she does is she takes medicine whenever she really needs them. And that looks okay. And the vital signs are temperature 98.2, heart rate is 102, respiration is 22, blood pressure is slightly elevated, right? 148/86. Now, she didn't have history of hypertension. I mean, she's not on any medicine. She's not diagnosed with hypertension, and she's not on any medicine for hypertension either, right? But she has high blood pressure. According to our, when we look at it, she has hypertension. And she also have tachycardia. What could be the reason? What do you think? Is she having really bad hypertension also? Like she is, it's not diagnosed, or is there any other reason? Can you figure out something which might be contributing towards this blood pressure and this heart rate at this moment? Pain, anxiety, severe pain, and my eyes, I cannot see from one of my eyes, and I will be freaking out, right? It is possible that she is having some underlying issues, cardiovascular, but at the point, I think it's more because of the pain and the anxiety. All right, so there is that. Now let's look at the physical examination. It says there is mild redness in the right eye. The right eye pupil dilated and sluggish to respond to light. So I'm thinking the nurse did the, light and the perla. She was probably looking for the perla, and there is dilation on the right. I mean, right side is the one which is having problem, right? And it's sluggish to respond. Left eye, no problem. Left eye is reactive to light and round, and that seems okay. And intraocular pressure. So I guess the doctor did the intraocular pressure, and it's 62. What do you think about that? 62. What is the normal intraocular pressure? Yeah, it's 10 to 21. Intraocular, not the intracranial. We are talking about the pressure inside the eyes. And the normal is 10 to 21. It can range between 10 and 21, depending on what time we are checking. But intraocular pressure can vary throughout the day. It's usually a little bit higher in the morning and kind of stabilizes towards the day. But still, it will be between that 10 to 21. That's why it's a big range. But this is really high. 62 on the right eye is really, really high. So now that you have additional objective data, right? I mean, you have all this information from the client, but now you have additional objective data, and you know the intraocular pressure too. Now let's look at the third question we have. It says, the nurse suspects that the client's symptoms are due to, there are 6 options, and you can select only one. What could be the reason now that you have all this information? Is it diabetes? Is it because of macular atrophy? Is it because of angle closure glaucoma? Is it because of retinal detachment? Is it because of smoking and alcohol? Is it because of medications? All right, really good. It is, we know now, at almost certain that this is angle closure glaucoma, because that's the pressure problem, right? So now, as evidence by what? You can select only one from here. Is it because you are saying that this is angle closure glaucoma? Is it because of tachycardia? Is it because of increased blood pressure? Is it because of increased intraocular pressure? Is it because of sluggish response of the pupil? Or is it because of the home medications? It is increased intracranial pressure, right? So we can say this is angle closure glaucoma. We know it is angle closure glaucoma because of increased intraocular pressure. Now, is this okay to select? And my answer will be not at this point with these choices. Okay. Now, if the increased intraocular pressure was not there, I would have selected D. Sluggish response of pupil to light would have been my next best answer. But because there is more appropriate, more focused for glaucoma, because increased intraocular pressure really is focused for the glaucoma, I will select that. Sluggish response of the pupil can be of so many reasons, including in the problem with the glaucoma, but it could also be because of many other problems. So if I have to select one which is really connecting the glaucoma, I will go for the intraocular pressure. In NCLEX, there could be choices which appears to be good, true, but there is some better ones, and we need to go with the better ones. Now, how do you figure out which is the better one? When it is more focused on the question. Okay? All right. So now we have one more. The question is not over yet. We have one more. It says the client is at increased risk of permanent blindness due to, there is angle closure glaucoma, there is increased intraocular pressure. So there is chance of permanent blindness. But why? Why? Okay, it's because of optic nerve ischemia. Right? That is the issue. So when the pressure goes up, in the, this is the slide which I think I have used it in our video lessons too. But when the pressure goes up inside, it is going to put all the pressure into this optic nerve, which is towards the back. And that optic nerve is going to get compressed. And if it is not relieved on time, if the patient has not being seen by a doctor and appropriate medications or procedures or whatever is needed, if it is not done on time, this pressure is going to cause damage, and its permanent blindness can also happen. So coming back to our question, our answer to this one is, it is angle closure glaucoma, is evidenced by increased intracranial pressure, and it is going to cause permanent damage. If you don't do something about it, it can cause permanent blindness due to the pressure in the optic nerve. So what do you think it is? If you look at it, what it is, it's worms, right? And these are the worms which you see. Let's say they are just talking to each other. So let's say this worm is talking to the other worm, and they're saying, "Oh, you're a worm." And if somebody else see them, they will say, you don't look good, right? You are slimy, and you are just on the ground all the time. And what is your life worth? Somebody is going to just eat you or maybe crush you under their feet. That's what your life is all about. And there is nothing much you can do. That's kind of the thinking process which is going on their mind. Why did God created me like this? I don't belong here. I wish I was someone else. Or there will be a lot of things they will be talking to each other. And it's possible, because if you really get someone to look at them and assess them, they don't have much, right? They cannot do much. They are just worms on the ground. And that's okay. But let's say one of these worms looked up, just because they just looked up, and they saw this butterfly. And now this worm is thinking, I wish I could fly like that. That's so beautiful. That butterfly is so beautiful. But look at me. I am doomed to be on the ground. I'm not worth much. Any bird might pick me up and I will become the breakfast for them. I cannot fly. I don't have anything in me. And that is going to be something so depressing. But let's say within themselves, somehow, let's say this worm has a feeling inside, and they have some kind of faith inside that one day I am going to get my wings. And if this worm is telling that to this worm, they're going to laugh. They're like, what are you saying? What are you thinking? Where is your wings? I don't see any wings in you. You saying that you're going to be like that, like beautiful and flying? No way. I don't see anything like that. You belong here, just as worms. That's what we are. And you will see a lot of people telling you that. sometimes we feel like we are having this worm life, this caterpillar life, but this is caterpillars. So we have those feeling that, we are not much, we don't have much, we don't contribute much, we cannot be much. And we feel like this is our life. Okay, we are always grounded, like just to be a worm life. No. Within you, if you really sit down and ask yourself, is that what you think God created for? Like, this is it? No, that's not it. Okay. Yes, you are having a little bit of difficulty right now, but that is not going to be the end of your life. You are so much more than you think you are right now. So sometimes what we see and we have been told is not going to be the right thing about you or about your life. You are going to be this. God made you to become this. Beautiful, soaring, flying, and happy, and doing whatever you like to do. God created for you that. But what you have to do right now is to trust the process. It is going to take time. There will be some time where you really feel like this is it, this is the end. But no, have that faith in you. Take a moment to remind yourself that you are worthy of the butterfly life. You are worthy of all the beautiful things you can be. It's important. Okay. And also it's very, very important that to remind yourself that you cannot just wait for the sake of waiting. Now, the reason why I'm saying this is the caterpillar life, when the caterpillar is in that worm kind of state, they are not just waiting and just laying there. They are busy eating. They are busy making that cocoon, that pupa kind of thing where they are going to be inside. So they are working all the time. They don't see the butterfly yet. They don't see themselves becoming the butterfly yet. They cannot see the future yet. But still, inside, they have the faith. And they are working and working and working towards this dream of becoming a butterfly. If the caterpillar just decide to oh, you know what, I'm just going to wait here and I'm going to get a butterfly, I'm going to become a butterfly one day, it is not going to happen. That worm is probably going to be crushed under our feet or a big animal feet, or it's going to be the food for some birds because it was not doing anything. But if you work on your weight, now it's important that you work on your weight, even though you don't have the wings yet. You are going to get the wings. You are going to go flying. You're going to get the dream. You're going to have that RN in your name. You are going to wear that scrub you are always been dreaming of. You're going to wear that stethoscope. You're going to go for that work. Okay, it's going to happen. But right now, it may not seem like. But that's not the end. God has beautiful things planned for you. You have to trust the process. Now, there are some times we may even go darker. Okay, this caterpillar, there is one time it has to go into even darker mode in a cocoon. It cannot even move. It has so limited space. There is no light. It's all dark. It cannot eat. It cannot even do anything other than just wait there. Now, some of you might feel like you are in a cocoon right now. And you might feel like, I was so happy being a caterpillar. God, I don't want to be any butterfly, but just make me back to my caterpillar form because this cocoon is killing me. If you think that, no. When that kind of pain comes, when that kind of darkness comes, you are almost closer. You are one step more closer to become a butterfly, to achieve your dream. So stick there, okay? Stay there. Stay there. Do not let your faith go away. Do not let your hard work be unfulfilled. You are going to get rewarded. It's just a matter of the process. Trust the process, right? So anytime you feel like you are in this stage, I want you to think about that. This is what you are going to become. You and me, we have a long way to go. And I wish you all the very best to reach there. And I can't wait to see you flying with all those different colors of scrubs, right? Like the pediatrics, the cardiac, the educator, the maternity, the the administrator and the teacher, the professor, the researcher, whatever you will like to become, you are going to become. So my praise and my blessings, right? Okay.